Welcome, everyone. I'll just give everyone a minute to come into the room. Welcome. Thank you so much for joining us today. Okay, I think we're all here. Okay, thank you so much for joining us. In case you don't know where you are, today's session is called Financial Health for Families of People with PH. My name is Kimberly Brunel, and I am the Support and Education Coordinator here at PHA Canada. I am thrilled to be joined today by Jyothi Venkatesh. I'll introduce her in just a second, but I want to remind everyone that today's session is being simultaneously translated. So if you haven't chosen your language yet, please do that. The instructions are just on the screen here. And also the session is being recorded. So if you want to watch it back, you can do that. I'd like to introduce you to Jyothi. So she is currently a lead staff of financial literacy at the North York Community House. As a financial literacy coach, she facilitates financial resiliency workshops for partner community organizations across the Greater Toronto Area. She also coaches individuals based on their unique requirements and also writes about financial empowerment as a guest blogger. So I'm excited about this session because we've had a couple of conversations and I think she's going to have a lot of great information to share. Later on, after Jyothi has finished her presentation, we are going to be joined by a few of our community members who will sort of just share their experiences with how PH has affected their financial health. I encourage you to ask questions throughout the presentation. You've got your question box in the chat box there. Please fill your questions in as the presentation is going on, and we'll be sure to cover all questions by the end of the session. So I'm going to stop sharing. Lindsay, I'm just going to send you out and I'll bring you back in after. Jyothi, if you want to share your slides. And you can just unmute yourself. You're still on mute.
Yeah, thank you. Yeah, so all of you can see my slides, right? Okay, yeah. So thank you, Kim, for the introduction, and it's really an honor to be here and to be presenting before you about the financial literacy for families with chronic illnesses. As Kim has already mentioned, we do a lot of financial literacy workshops around this area and many other different areas. So we'll be talking about why and how financial literacy is so important, especially when one is dealing with chronic illnesses. What is it that we are going to discuss about? So the agenda is given here. So we are going to talk about what exactly is money management. As we all know, money is very important for anything that we do in life. Nothing is free. So we are going to discuss about how exactly to manage the money given a particular situation. And particularly, we're going to focus on different ways of managing money for people with chronic illnesses. Then we are going to move on to what are the different benefits that people with chronic illnesses can access, the federal benefits. Then we're going to talk about provincial benefits. There is a wonderful new tool which is developed by other agency called PHA Canada, which works at pan-Canadian level with various partner agencies. So they have come out with the tool which lists all benefits that one is eligible for given their unique situation. So we're going to discuss that a little bit about that tool. And we are also going to talk about how can people get free financial counseling from nonprofit agencies. And then I'll be happy to answer your question and answers. As Kim has already indicated, please type in your questions as we move along. Okay, I don't have to tell you this. We all know that money needs to be managed. And everything, as with everything else, whether it is education, you manage your education, manage your health, manage relationship, you have to manage your weight, and money is no different. Money needs to be managed in order to meet our objectives. And these objectives could be time bound. It could be short-term objectives, long-term or medium-term objectives. Now, when one is faced with a particular situation, such as chronic illness, then we need a focused money management to deal with, to alleviate or to reduce the financial stress caused by the illnesses. So we are going to discuss what are the various options do we have to reduce this financial stress when one has this chronic illness. So there are different ways to manage money. I would like to tell here that there is no one size fits all. These are just different options. One has a couple of options may work for someone and some other options may work for somebody else. So these are just general options and you need to tailor it according to what you think fit. So let's look at the various options. You have personal money management. Then you have medical insurance. That's very, very important to manage chronic illnesses. Then we have federal programs which will help you to manage your cash flows. Same with provincial programs. We're going to discuss all this. And there are fantastic caregiver benefits that how can caregivers, mostly the families of people with chronic illnesses, how can they manage their money? That's also very important. And then finally, how can non-profit sector help you to manage your cash flows? So these are what we are going to discuss today. What do we mean by personal money management? Personal money management is simply what you can do it on your own to manage your money without any external intervention. So money management is basically, it's just managing your cash flows, cash inflows and cash outflows, as simple as that. And as long as your cash inflows are more than your cash outflows, you will be in a comfortable position. So what we are going to discuss is how exactly to do that. How do we make sure that our inflows are more than our outflows? So with personal money management, that is where you try to manage your own money. So there are three different options that you have under personal money management. There are budgeting tools, first one, then tax filing on time, and then we have financial literacy. Let's discuss this very briefly. What exactly is budgeting tools? Now, we all think, oh, budgeting is such a simple thing. We all know what budgeting is. Absolutely, I'm sure all of us know what budgeting is. But then when you have this, when you create a budget with the focus of managing your money because of some particular situation, such as illness, then it becomes more of an art. So treat drawing up budget more as a piece of art, like an artwork that you do, like a drawing that you do. So how do you draw your drawings? Like when you draw, then you look at it, then you realize that the strokes are not coming properly, you erase it, you again, thicken the lines or whatever. Something similar is what budgeting is. It's just a work of art, which you keep doing it till you are satisfied. So how does it help you? It helps you in expense management. This is absolutely critical for everyone, and more so for people with, chronic illnesses. It helps in expenses, to manage your expenses. And also it's very flexible. Budgets are not something that is set in stone. Like I told you, it's a piece of artwork. You keep changing, you color it differently. Same thing, budgets are very flexible and can be done periodically. You can have a budget for 1 week or for 1 month, or create it, let's say every 6 months or annual. It's up to you, whatever you're comfortable with. We are going to look at a simplified budgeting template in a bit that helps you to understand how exactly can you use it as expense management. We'll come to that in a bit. Now let's look at filing tax returns on time. I can't tell you how important this is. Like as Kim has already said, I work for a non-profit agency, and one of our job responsibilities is to help clients to file their tax returns. And when you file your tax returns on time, you get benefits that helps you to manage your cash flows. It's very important to do it, to file your tax returns before 30th of April of each year, which is the deadline, and then you get your benefits on time. People with chronic illnesses do get benefits upon filing tax returns. One of the most important benefits is the disability tax credit. We will come to this a little later, and how you can use this disability tax credit to manage your cash flows. Then comes financial literacy. It's important to have some knowledge about financial matters that affect you. You don't have to know about the entire financial economy, of course, but just a little bit that affects you. And there are a lot of resources in Canada that will help you to understand what is financial literacy and how do you take decisions based on your unique situations. I have listed just one resource for the moment. The last bullet point under financial literacy, it is called Financial Consumer Agency. That has a lot of resources, and especially how to manage your money during disabilities. It has a special section on that. I would request all of you to look at it if you haven't done it already. It's a great resource to manage cash inflows and outflows. So these are some of the personal money management techniques that you can do it on your own, as I said, without any external interventions. Now, let's look at a simplified budget template, the one that we discussed on the previous slide. As I said, it is simply a money management technique to manage your expenses. Now, if you look at this template, this is just a hypothetical scenario where on your left-hand side, you have income that is listed. For example, here, monthly take-home pay here in this hypothetical example is $3,000, and there's some government aid of $500. So the total income here monthly, we are doing this budget on a monthly basis, is $3,500. You look at the expense side, which is on your left-hand side. The expenses are categorized as non-discretionary items and discretionary items. What is the difference between these two? Non-discretionary items are those items which you have to incur, over which you may not have much control. It has to be done. For example, let's say rent. Rent you have to pay every month, whatever rent has been decided. You cannot say that, oh, this month I'm going to reduce it a little bit. The landlord is not going to like that, right? So that needs to be paid. Groceries, health insurance, mortgage payments, all these are compulsory, mandatory payments. That's why it's called non-discretionary items. Let's look at the discretionary items. Discretionary items are those expenses over which you have some control. You can reduce it when you want to. And when you think you have enough money and you would like to have a bit more fun, then you can increase that as well. So you have that liberty to increase or decrease. That you have a discretion over those expenses. They are called discretionary items. Say eating out, for example, Netflix or magazine subscription. All these are discretionary items. Now, what makes this budget an art, as I said earlier, is when you calculate the percentage of these expenses, percentage as of total income. For example, what percent of grocery expenses is as calculated according to my total income. So that comes to about 9%. So 9% of my total income, which is 3,500, is groceries, which is 300. I have just rounded off everything here just for the sake of clarity. And look at the rent. 46% of my total income, total monthly income, is rent. So like that, it goes on. So when you calculate every expense as a percentage of your total income, it gives a better understanding as to what is the major expense. Can you reduce it? For example, here, let's look at the miscellaneous expenses is 6% of your total income. So what do you mean by miscellaneous expenses? It could be anything, let's say, for example, bank charges, right? Occasionally you withdraw money from some other ATM, not the ATM that is associated with your bank. If you withdraw money with some other ATM, then you will be charged, right? So something like that is miscellaneous expenses. So that can be greatly reduced, right? And that can add to your bottom line. So finally, this is the ultimate goal: savings, how much you want to save, and savings for emergency is different from long-term savings. So it's better to have two different savings. One is for emergency, one is for long-term account. So this is the budgeting template in brief of how you can adapt according to your situation. And this is a great tool for managing your expenses on a periodic basis. Now, let's come to medical insurance. For everyone, medical insurance is very important, and more so for people dealing with chronic illnesses. So there are two types of medical insurance that you can use. One is, of course, the public health insurance, which we have in Canada, which is either completely or partially funded by the government. Then you also have private health insurance. So for private health insurance, an individual needs to pay premiums. It could be monthly premiums, or it could be an annual premium depending on the contract. So there are a lot of private health insurance in Canada, insurance companies in Canada, like Sun Life, Great West Life, etc., that cover a range of illnesses. Okay. Now let's come to public health insurance. What exactly is that, and how does it differ from private health insurance? Each province has its own health care. For example, in Ontario, it is called OHIP card. You have Alberta card, then you have Manitoba health card. So all these health cards are publicly funded. So you don't have to pay for anything. You can use it for doctor's visits, blood work, etc. But this is all regulated by provinces. So what does the major costs come from for a person with chronic illness? It's basically for drugs, for surgeries, and of course, sometimes ambulance charges. Now, are these covered by your health card, for example, right? Depending on the province. Drugs are not covered. Drugs are separate, for which you may have to pay depending on what plan you have. Most of the doctor's visits, etc., are all covered, of course. What about ambulance charges? Now, in Ontario, this will be something similar province in other provinces as well. It's usually co-paid. So in Ontario, we pay part of the ambulance charges and the government pays part of it. Usually ranges around $40 to $45. Then what about the drugs? In Ontario, Alberta, Manitoba, Saskatchewan, Newfoundland and Labrador, there's some of the drugs, since we are dealing with pulmonary hypertension here, then some of the drugs for pulmonary hypertension are available under public drug program. So that means it is publicly funded. So you get it at a much cheaper cost than otherwise if you had it not been publicly funded. So let's look at some of these drugs programs that are available in different provinces. It's available in almost all the provinces that we discussed earlier, but I'm going to talk from an Ontario perspective. Now in Ontario, we have specific public drug programs in which the individuals who buy these drugs have to pay only a small part of the total drug expense, and the remaining is covered by the program. These are some of the drug programs that we have in Ontario. That's Ontario Drug Benefit Program, where this is the program where even over-the-counter medication is also covered. Then there is Trillium Drug Program, in which some of the special drugs are covered under Trillium Drug Program, which is prescribed by the doctor, of course. Then there's Special Drugs Program, which, drugs for some special, conditions are covered under Special Drugs Program. Then you have Exceptional Access Program. Now here, the drugs which are not covered by the other programs are covered here. But of course, you have to apply for it, and it has to be approved by the ministry. So there's an application requirement for all these drug programs. But once approved, most of the drug costs are covered. In Ontario, if you're here in Ontario and if you want to check if your drugs are covered, then this is the link that has been provided here. You can even call toll free to check if the drugs are covered by these public drug programs. It will help a lot in your medication expenses. Okay. Now that we have discussed about public drug programs and public health insurance, let's look at private health insurance. Is it something that people with illnesses can make use of? Yes, of course, but there are certain caveats. Now, there are a lot of private health insurance providers in Canada. You have Manulife, you have Blue Cross Canada, Sun Life Assurance, and Canada Life Assurance companies. These are just some of the private health companies that are available in Canada. Now, one of the important things of subscribing to a private health insurance is that some of these companies also offer medical travel insurance, which helps greatly in expenses that you have to incur if you have to travel for health reasons. Now, what are the important things that you should keep in mind when you consider a private health insurance? Now, always you have to pay the premium amount. So you have to look at how much is the premium amount? Is the illnesses that you're looking at, obviously, if it is covered, that's the first thing that you should check. And how much is your deductible? There's a difference between deductible, co-insurance, and co-pay. So if you are subscribing to a private health insurance, then it's important to understand what do these three things mean. Deductible is the set amount you have to spend first on your medical requirements before the insurance kicks in. That is known as deductible. Let's say if you buy a Sun Life medical plan, for example, and if it says that the deductible is $2,000, then you first have to spend that $2,000 before the insurance benefits kicks in. That is known as deductible. What is copay? Copay is a set amount that you have to pay every time you make use of the health insurance plan. Let's say you're buying drugs, and if you're buying your medication, and let's say it's some copay is around $10 usually, then from the total medical bill, for that medicines, you have to pay $10. Remaining is paid by the insurance. What's co-insurance? Co-insurance where it's in the percentage form. For example, 80%, 20, it is not a set amount as in copay, but it's more as an insurance, it's in percentage. So from the total bill of your medication, let's say if it is 80-20%, that means 20% of the bill you pay, 80% of the bill is paid by insurance. So it's important to keep in mind what all these terminology mean, because that helps you in budgeting, right? So if it's 80-20, for example, then you know you need to keep 20% of the money handy in order to pay when buying these drugs. It's also important to know what's not covered by the plan, because based on my experience, like when we coach clients, I remember like some of my clients who had some illnesses, they thought certain medication was covered and they just went ahead and purchased. And at that time, when they went to pay for their insurance, it was then realized that it is not covered. So better to first make note of it, call your insurance person to make sure that whatever medication that you buy is covered. The last bullet point is very important, because pre-existing conditions, it means that before buying that particular medical insurance, private medical insurance, you already have some condition, health condition. Then some of the insurance companies may not, then you may not be eligible for that insurance if you already have a pre-existing condition. But some of the health insurance companies do accept some preconditions that you may have. But however, if you already have some preconditions and they accept you for the insurance plan, then your premium may be a little higher. So it's better to take note of all these things before deciding on a particular health insurance. Okay. Now let's come to federal benefits. We are talking about public and private health insurance plans. Now let's look at what federal benefits a person with chronic illnesses is eligible for. There are quite a lot of benefits actually. So let's look at the first one, which is registered disability savings plan. I'm sure some of you may be already investing in this. So this is a savings plan for people with disabilities, provided they have what is known as a disability tax certificate. So you should already have a disability tax certificate approved by the Canada Revenue Agency in order to open a registered disability savings plan. And you can invest in this plan as long as you are up to the year in which you turn 59. You can invest in this plan. There are a lot of advantages in the sense that the government also contributes to the savings. It pays a matching contribution in the form of grants, which is almost 100 or 200, 300% of what you invest in that, of course, depending on the family's net income. Every year, the government maximum grant that it pays into RDSP is $3,500, and there is a lifetime limit of $70,000. Some of my clients have benefited hugely by investing in RDSP. And this account can be opened at major banks in Canada. And of course, the link is provided here for more information about how to calculate how much grants that you will receive depending on your family's income. What's disability tax credit? It allows an individual to claim disability amount. So it's a form which you need to fill in, a person with disability needs to fill in, and also your doctor needs to fill in, and you need to send it off to the CRA. And once they have this DTC on your records, you can claim the disability amount. Now, this is a refundable tax credit. What exactly is the meaning of disability amount? People mistakenly believe that it is an amount that you get into your bank account. Actually, it's not. It is a non-refundable tax credit. What it means is from this disability amount, a tax credit is calculated, and that is applied to the taxes that you need to pay. So your taxes reduces because of this. Or you may end up with zero taxes, and indirectly that increases the refunds. And this amount can also be transferred to the caregivers or other family members, who care for the individuals. So that's so the caregivers also are benefited greatly by the disability amount that is transferred to them. Of course, if you have worked before being, having the illness, then you're also eligible for Canada pension plan benefits. Now, CPP disability benefit, if you're under 65 years of age, you are eligible for this benefit as long as you're not already receiving the CPP retirement pension. And between 60 to 65, and if you have retired already, then you also get post-retirement disability benefit, provided you have already been receiving the CPP retirement pension for more than 15 months. So these are some of the rules. So if you have worked, then you are eligible for this as well. Now, most of the provinces also have a lot of benefits that people with chronic illnesses can access. In Ontario, for example, we have Ontario Disability Support Program, which is a monthly income support that is provided to people with disabilities. Then there is Saskatchewan Assured Income for Disability. Then there's Manitoba Possible. So the different provinces have their own plans for people with disability income supports for them that they can access. Of course, there are a lot of, again, there are some regulations, and you will have to kind of make sure that you are eligible for it. For example, in Ontario, when individuals who have been receiving ODSP, if they hit 65 years of age, then other pensions kick in, like the OAS, the old age, and CPP and all that, because of which that affects the ODSP payments. So when you're aware of all these things, budgeting becomes easier, and that helps in your cash flows, and this reduces the financial stress greatly. Now, this is very important, especially for the families who care for people with chronic illnesses. There's something called Canada Caregiver Credit. Again, this is a non-refundable benefit in the sense that the money doesn't come to your bank account directly, but it's a benefit which reduces your taxes greatly, and that indirectly increases your refunds. So if you're caring for someone who is infirm and who has a disability tax credit on their records, and you're caring for such a person, then these caregivers can claim for Canada Caregiver Credit. Okay, so the non-refundable tax credit is 15% of 6,883. That is the maximum benefit that you can get. Again, this depends on the income of the caregiver, and this is used to offset the taxes that the caregiver pays. Now, there's something called employment insurance, caregiving benefits. This is, again, a benefit given by the government. And this is especially for caregivers who have to leave their work or reduce their number of working hours in order to care for someone with chronic illness. So the eligible individuals, they receive almost 55% of their earnings. It's a weekly pay of $638. You have to, of course, prove that you are taking care of somebody with chronic illness with a doctor's certificate. And more information is, of course, given and provided in the link here. So caregivers are also greatly benefited by these federal and provincial benefits. Now, I find this tool amazing because I coach many clients as a part of nonprofit employee, and the Benefits Wayfinder tool, it is developed by an agency called PHA Canada, which is, again, a charity which works with various partner agencies across Canada. And this has created a tool to enable Canadians to access benefits to reduce their financial stress. It's a very comprehensive list of all benefits, and the list is generated by the software depending on your unique situation. So this helps a lot for each individual because it gives you the list based on whether a newcomer or whether you have a chronic illness, etc. It gives both federal as well as provincial benefits all in one place. This is simply fantastic. And this online tool is called Benefits Wayfinder. We also coach clients individually on how to use this Benefits Wayfinder. So the link is provided here. Okay. In the interest of time, I'll skip showing the Benefits Wayfinder, but the link is given there. So all of you can definitely, just explore that link. So I'm just going to end with some of the nonprofit agencies that can help you, people, especially people with, chronic illnesses or their caregivers, how to reduce the financial stress. CreditCanada.com, it's a nonprofit agency that deals with debt consolidation. So, people with illnesses, they also have debts. Then Credit Canada helps such people on how to consolidate the debt and how to pay it off. NYCH, that is the agency that I work for, North York Community House. We provide free financial counseling and tax filing services to eligible clients. So we have this eligibility. When we say eligible clients, what we mean is people with low income. Then there's moneycoach.ca, where you can enhance the financial literacy. You can get a lot of information about financial literacy here on budgeting, on loans, on mortgages, and all of these. Then there's credit counselling, Canada.ca, which helps you again with counseling about credit cards and those issues, and about credit reports, which is very vital here in Canada. And of course, there's FCAC, Financial Consumer Agency of Canada, which is at the federal level, which has amazing resources on how to reduce financial stress given a particular situation. Okay, so thank you very much. This is what I had to say about various ways in which you can alleviate the financial stress. I'll be happy to take your questions during the Q&A session.
Thank you so much, Jyoti. I appreciate it. I'm just going to bring onto the stage a couple of community members. Jyoti, you can stop sharing if you'd like. Where are you? Here we go. I'll bring up Kathy and Dawn Downey, and I'm also going to bring up Lindsay. Okay, just give them a second to get on stage. I call this a stage. It's as though we're actually in person here. We'll try to recreate it as though we're in person and they're coming out of the audience to do this. There's Kathy and Dawn, and then I'm just waiting on Lindsay. I just thought it was important to just give this a bit of a PH lens and to talk a little bit about how a diagnosis can affect us financially, and Kathy and Dawn and Lindsay were kind enough to volunteer themselves to share a little bit about their story and how they've been impacted. So I'll leave it with them. Kathy and Dawn, do you want to go first? Do you mind unmuting yourselves, and maybe just you can introduce yourselves and tell us a little bit about your story?
Okay.
Yeah.
I'm Dawn. Kathy was diagnosed with PH in March of 2020. Our PH journey has all been through the COVID and everything else, because it was right at that time. So it's been interesting. I'll go back a little before that. Kathy had problems where she was tired. She wasn't able to work full time. Fortunately, we were self-employed, but she had reduced a number of hours that she could work and everything else for several years, but we didn't know what it was. And, so that caused some financial problems because we were reduced in income and everything. Then her diagnosis came right as COVID hit, and we had some money in the bank and everything. And we've got 2 adult children that were living with us. They were both out of work temporarily because of COVID and everything. So we went through all of that. And the bank account very quickly got depleted. So then we were dealing with whatever was available that was served and all that type of stuff. But we, the biggest problem that we found was there wasn't a lot of information out there as to the programs that were in the presentation here and all that. So it's something where we had to kind of scramble to find, and finally found stuff. And then last July, Kathy applied. We're in Alberta, so it was the assured income for the severely handicapped is our provincial one. She applied for that, and they tell you that the average person, it takes about 4 months to be approved, which we first heard from them after 4 months that there was one form that she needed me to sign that had gotten missed. And we're still waiting for approval. So it's been tough. We've been, fortunately, we've got Kathy's parents here with us, so we've been able to kind of work with them. Our kids have been providing, some of the help financially just to get through while we're waiting for all of this. And it had reached the point because we're hopefully, it's looking like this coming week the approval will come through, but we couldn't wait. I actually went back to school last fall because COVID put me out of work. The company I worked for died, and there were no jobs in that industry for me. So I went back to school, and then I tried getting a summer job here in Calgary. Problem being that all the summer jobs that I could find are subsidized by the federal government, and you've got to be between the ages of 15 and 30. I have a 27-year-old son. Do the math. So anyway, I am actually leaving Monday morning or Monday during the day for Waterton Lakes National Park, where I'll be working in a hotel for the summer, and then I'll be back in September for my second year of school. So we've been through it, and just trying to get everything, make sure that we can keep all our debts and all our commitments, financial commitments in line. That's about where we're at. Yeah.
Thanks so much, Don.
Yeah.
Lindsay, can I ask you to unmute?
Hello, everybody. I'm Lindsay. I live just outside of Ottawa, Ontario. Every province is different, which is kind of unfortunate that, Kathy has to wait a significant time period for benefits to kick in and things like that. Thankfully, I was pretty fortunate. I didn't quite have to wait as long for a lot of my benefits to kick in. They were fairly quick here in Ontario. A little backstory about me. My diagnosis came October 2018 when I was officially diagnosed with pulmonary hypertension. At the time I was working. It took about 2 years to get an accurate diagnosis when my symptoms started in 2016. And at the time, I did try and work with oxygen. I tried the best that I could, and it became very difficult to do my job having the oxygen all day. So I did end up going off of work, and I did have to apply for EI. So, it is pretty stressful going through all the paperwork for that. It's definitely a big change because it's not something you expect in life to have to, fill out the paperwork and wait for approval and things like that. So I went through the EI. That's a 15-week benefit period. So it was, a percentage of my income that I was getting. And then once that was depleted, I ended up going on long-term disability because I was unable to return to work at the time. And in that process, I was also listed for double lung transplant as my PH condition had worsened. So I was dealing with applying for the long-term disability, as well as going through the, the transplant process for approval and things like that, all the testing. So that was pretty stressful. On top of that, throughout that period, it was nice though, because I had private insurance through my employer. So a lot of my costs through transplant were covered. Like OHIP did cover the surgery. My hospital stay was covered through my, private insurance. So that was always nice to kind of fall back on. But I did also we did a fundraiser for the transplant. So we had a lot of, support financially in that respect, because we didn't really know how it was going to go if I had to move to Toronto and wait it out, because Toronto is very expensive. Now that was in 2020, I had my transplant. So I can just imagine now the prices in Toronto have, significantly increased for, rental properties and things like that. So it was nice to have that financial kind of crutch. Now I am listed again for a second transplant, so we still have those funds available, which is really nice to have. I was fortunate enough that my parents do live in the Niagara region, so I was able to stay with them while I was waiting for my first transplant. So that helped a lot, financially with lodging. Food as well is another one. But again, like Jyoti mentioned, the disability tax credit was something that I did apply for during that disability period, as well as just, the savings aspect of it, not getting that full income anymore. You really have to think about where your money's going. So, budgeting, even if you have a simple budget, anything helps just to kind of see where your money is going. And, sometimes it helps make you realize that you're actually spending more than you should. Or where you need to cut back on, or, asking yourself, do I need this? Or like, where can I cut back? And, the payments too, you're used to getting paid every second week. Most people anyway are biweekly, but, when the insurance kicks in, it's kind of on their own schedule. And the way mine pans out is at the end of the month. So I kind of get one lump sum instead of, it's not broken down. So you really have to, you get that amount and you have to kind of separate it where you need it most. Like your fixed incomes, go in one account, your variables kind of stay in another, and you kind of make it work the best that you can for your situation. So yeah, there's that. And like I said, CPP as well, because I was off so long. My private insurance did reach out and say, like, you should be applying for CPP just because you have been off so long. So again, more paperwork to fill out in that respect. And they are continuously sending, updates every year to make sure you're still on disability, make sure you're not returning to work. They do kind of make sure that your volunteer hours too are to a minimum, because you can only volunteer so many hours. So there are kind of restrictions there in terms of the disability, what you can and can't do. But yeah, those are kind of the how should I say it, the scenarios that I've been through, and the ways that I've kind of managed financially through it. So yeah, I don't know if anyone has any questions, but
Thanks, Lindsay. It's interesting in the session we just had previous to this, Carl Seltzer was mentioning this of being on disability and the idea that he sort of wanted to work a little bit, couldn't work full time, but wanted to go back to work a little bit, in that, like you're saying, that limitation of the rules you have to play within, and how he found that very frustrating. And he is volunteering, but also has to be careful with that as well.
Well, that's the thing, like, as I'm waiting, it's hard to be at home, because I should be out there working, right? So that was hard for me to adjust to, being at home all the time. So I did start volunteering with the Girl Guides of Canada, and I just recently got a notice from CPP saying, you can only volunteer X number of hours. So thankfully I'm within, the recommended hours. I don't have to reach out to them or anything, as nothing's changed to warrant contacting them. But you hear all these stories about being watched, and you really have to be careful about what you choose to do while on disability.
Yeah, that's a good point to bring up about volunteering. You may not think that that is seen as work per se, but it is. Yeah,
because you're just trying to live your life to some degree still, and try and help out in the community, but you're limited as in terms of hours per week.
Thank you. I have a couple of questions that have come up here. Lisa Kolkman, who's a wonderful PH nurse in Vancouver, is asking if it would be possible to put some of these great resources that we've received today either on our website or sort of into a handout that we could put out in the clinic. I think that's a great question, and I was thinking about it as I saw that question, and I thought, speaking to what Kathy and Dawn were saying, I wonder if this is something that in our new to PH kits or things like that, when we get new patients who are new to PHA Canada and we send these kits out, I wonder if we could have, would it have been helpful to you to have had a one pager or something that would have guided you to some of these tools that you would have known about to start, rather than sort of finding out as you were going along. So yeah, at least I think we could do something with that. I'm not sure what that looks like yet, but it would need to be province specific, because as Josie was pointing out, it's different in every province.
Yeah, that definitely would have been helpful, because you're diagnosed, and then if you find out you have to be on disability and off work, you kind of sit there and say, where do I go from here? Like, you got to find your resources via internet or call the government or things like that. So something like that would be definitely helpful for newly diagnosed patients, for sure.
Yeah, we've been saying we need a full-time social worker on staff, and I think we also need a full-time financial support person as well. We just need more of us. It would be great. But yeah, I think that's a great suggestion. Thanks, Lisa. The other question is about, and this is towards you, Jyoti, is the EI caregiving benefit. You mentioned that in a previous slide. Do you know, or can you comment on, is there a cap on the length of time that somebody can be eligible for that? So if you apply, and are you capped at how long you can claim that benefit?
Yeah, you can claim the benefit as long as you're caring for somebody who has a DTC. That's important. The individual whom you're caring for should have a DTC on his or her record at CRA. So as long as you're caring for that person, then you can claim for this. No, but yes, I mean, you can claim for the disability tax credit transfer in your tax file. But the EI benefits itself, yes, I think that I don't exactly remember, but there is a cap for the time period in which you can claim. Yeah.
Okay.
Yeah.
And is there a definition that you have to be able to define as a caregiver? Is there some kind of definition that you have to meet, or are you able to simply rely on the fact that your immediate loved one would have that disability?
No, there is a definition for who is considered as a caregiver in order to get these benefits. That's a person who has been working and who has left to work in order to care for somebody. That's very important. You should have either left work or reduced the number of hours of work to care for someone, then you will be considered as a caregiver. Yeah.
Okay, thank you.
Mhm.
Are there any other questions? You can pop them in the chat box or in the, oh, sorry, Joanne, here you are. So Joanne's asking, because of the extreme cost of the medication, I'm hesitant to retire because of my meds. They're not covered by Trillium. I understand that some drug companies will cover meds. Does anyone know more about this process? I'm not sure if any of our panelists can answer that one.
I know I reached out to Trillium because my private insurance didn't cover a certain medication, and it wasn't covered by OHIP either. But Trillium was able to cover my medication, so I didn't have to navigate through any other, medical companies to see about coverage. So unfortunately, I don't really know the answer for that one.
What about exceptional access program? It's supposed to cover for drugs that's not covered by Ontario Drug Benefit. So maybe the person who asked this question, they can explore this exceptional access program. So I just provided that link and that phone number. So if that a participant can call that at that number and ask which of the programs would cover the drug that the participant is taking. Yeah. So I think exceptional access program should have, that program should have some answer to this question.
That leaves you, Joanne, in a really tough situation, maybe wanting to retire or needing to due to PH, but not wanting to because you need that coverage. That's a really tough position to be put in.
Yeah.
I don't see any other questions coming in. Any final comments from either Kathy or Dawn or Lindsay, or you, Jyoti, as well?
Yes, thank you. Thank you all of you for taking time to be here, and thank you to all those who shared their experiences. It's really valuable. As a financial coach, this has definitely added inputs for me especially, and the things that I should keep in mind while doing this kind of financial coaching to people with chronic illnesses. That has helped a lot. So thank you for sharing your experiences. And thank you to PHA Canada for inviting me to make this presentation. It's indeed an honor. Thank you.
I'm so glad you could come. And I think what's important for people to know is how there are people like you out there that do this kind of work and that are accessible by members of the community. How do you folks in their own provinces find people with your expertise?
They can find out like FCAC, what I said, I mean, I just provided that link. That is across Canada. So there will be certain number of community agencies according to province that offer this kind of service. The list is mentioned in FCAC website. I know it's a bit difficult to navigate because that website is huge and it's not very easy to navigate. The another way to find out is go to this benefitswayfinder.org. That's amazing, and that also provides very easy to navigate, and that provides a list of community agencies across provinces. It's based on provinces that people can reach out to for getting a free service. Yeah,
great. I'll share out the slides, Jyothi's slides after the presentation with all of you, just so you can get those links and those phone numbers if they're useful to you. And if you have any direct questions from the presentation, feel free to reach out and I can connect you with Jyoti, or we can get the answers for you. So we are right on time. I want to thank Kathy and Dawn and Lindsay and Jyoti, of course, for joining us today. If you have any questions, feel free to reach out. And thank you again so much for joining us for the conference. And we've got a break here for half an hour. And then I hope you'll all come back for closing. It'll be an exciting presentation on research trends in PH. You don't want to miss it. So thank you again so much, and we'll see you shortly. Bye,
Thanks for
everybody.
having us.
Thank you.
Thanks so
Bye.
much.
Bye.
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 Guys.